you for being here with us.
It's a pleasure.
Happy Sunday
It's
to you.
same to you.
And I'm sure it's good evening where you are.
It's evening, 4 p.m.
Uh,
I'm in
thank-
Lagos actually right now, though I was in
oh,
Nairobi a week ago. Yeah, this time last week I was in Nairobi.
oh, beautiful. That's nice. It's a very beautiful place. So thank you very much. And we have quite some people who have joined the call. Technology, I won't even explain what happened before. But anyway, we are here, we're live, and we're good to go. So thank you very much. Everyone, and welcome back to another life, the same life, but another another one. And as we put in the chat, welcome and please tell us where you're joining from. We'd like to know where you're joining us from. While we just do a bit of an introduction, housekeeping rules, and then we'll get going. So, as you all know, Digital Health Skills for Africa is a nonprofit that is founded with a mission to build a digitally enabled healthcare workforce in Africa. We have a couple of programs. First is our signature digital health training, which is geared towards early and mostly mid career healthcare professionals to promote innovation. We also have needs-based webinars and boot camps that are tailored towards the African context, as well as provide mentorships for women in tech or getting into the digital health space, and provide online resources all tailored to the African context. And one of this is the program we're having today, which is the first in the lineup of series of career talks, which you're calling the Career Showcase. And Dr. Uzome is our very first guest who is opening the floor for us, and we're pleased to have you on the show today. And this event is where we get to chat with experts in the digital health space to talk to them about how they got thus far in their career in this space. Because we know in Africa, there's no one straight pathway to get into the digital health space. So once I find out from these people, how did you do it? So that's really what the conversation today is about. And for us to before we meet the speaker, please tell us in the chat. We can see Clement and Dovo from South Africa. Other people who are joining us, please let us know where you're joining us from in the chat as we progress. And if you have any questions as we move along in our conversation, please put the question in the chat and we can pose it to Dr. Ozo Umi. So we want to meet our speaker today, and I will also introduce myself. But first, let's talk about our speaker. Dr. Ozo, as he's fondly called, is a program director and chief medical officer at Zuri Health, an award-winning health tech that began in Nairobi, Kenya, and now present in 8 African countries, where he drives key strategic programs and handles medical operations across the group. He combines a wealth of experience from Afia Care, Nigeria's largest integrated healthcare company, where he joined from its inception and scaling of flagship our Gillard Hospital to become the biggest hospital network, as well as payment experience from MasterCard, where he was responsible for optimizing several mid-sized accounts across the rest of West Africa. Quite impressive. Dr. Uzo holds several advisory and consulting roles for entrepreneurs, MSMEs, and venture investors in health. He finished his medical degree from the University of Nigeria in Soka. Hi, Lion. I'm a lioness as well, and is an alumnus of the Lagos Business School, LBS, nice, where he completed his MBA program and is a proud member of the Beta Gamma Honor Society. Welcome, Dr. Ozo, and thank you for gracing our screens today.
Thank you. It's a pleasure to be here, as always.
Okay. Yeah, and so my name is Izinomekwe, and I'm the Executive Director of Digital Health Skills for Africa. And I've just briefly explained what it is that we do. And we're going to get into the session today. I can see some people also joining us from Nigeria. Like I said, please put in the chat where you're joining us from and the questions you have for our guest today. So, Dr. Uzo Ume, we know your name, we've done your bio, but tell us in your own words, who is Dr. Uzo Ume?
All right, thank you. So, once again, it's a pleasure to be here. I think just listening to what you were reading, I was like, okay, this is all this has happened in such a short while for me. Basically, let's just say I'm a a medical doctor who, you know, um, sort of got bored along the way and just wanted a bit more about healthcare, right? Growing up, I had always seen healthcare, the debates that had been going on about healthcare being a science, healthcare being an art. You have physicians who, understand the ins and outs of healthcare, of medicine, and you had, physicians who also took their time to really practice it with that art and that, panache, as it were. And for me, I had always seen healthcare as a business. I don't know if it's because of my upbringing or, just how I see life. And so medicine was just kind of boring to me, right? Through medical school, I didn't see any, specialty or any part of medicine that was really exciting. And to go into obs and gynae, obs pediatrics or neurosurgery or whatever, cardiology. But for me, I just wanted to understand more how to really improve and understand how healthcare works. So I think along the line, I decided I was going to do an MBA because I felt like that was the quickest pathway to understanding, first of all, to getting new knowledge, one, two, to opening up my networks, because I felt like doctors didn't just have strong networks and they were just sort of like tripod people, book, home, church, or whatever. And I just wanted to open up my networks, explore, meet up with people who are running businesses, people in fintech, people in banking, people in FMCG. They were deploying a lot of technology and a lot of, new ideas in how to improve service delivery. And that was how, you could say my mind got blown open to new ideas. And, I eventually saw that digital health was a very new and, promising, would I say, subsector of healthcare to actually specialize in. And so for the past, I would say 3 to 5 years, I transitioned between like healthcare business where I was involved with healthcare acquisitions, investments in healthcare, trying to expand the hospital network. Think about it like what we all saw growing up with the banks, where banks were merging, acquiring other banks, Intercontinental Bank, seeing that actually happen with hospitals, hospitals buying up other hospitals, merging them into the same brand to become bigger, mega moths, as it were. And then now to actually trying to, grow and expand digital health to see how digital health can help to reach the last mile patient in the most remotest of places in the continent. So that's basically what I spend my days doing. I'm married to one wife, and then I based mostly between Lagos and Nairobi. So you may see me talking about things with my understanding of the context from East Africa to West Africa, which is where I basically sit from.
Beautiful. So I can really relate with your boredom with medicine because I'm a pharmacist and I got bored even before I started. And so I just practiced pharmacy for 1 year. So, I mean, traditional pharmacy for 1 year. But let's get back to the beginning. Before you even started practicing, what inspired you to go into the healthcare career, and how did you sort of identify that passion? Because some people, wonder, it's medicine for me in this age where everybody's talking about tech. Does it still make sense for me to go and study something like medicine, to go into the healthcare pathway? So what inspired you to pursue this career, this pathway in medicine, and how did you identify your passion for um improving healthcare systems even after you've gotten the degree? Because you could have gone the traditional route, but how did you identify that passion?
So for me, it was so growing up. I think if I wasn't a doctor, I was going to be an economist. That was actually one aspect that I was torn between choosing a career in health in medicine or healthcare um, and economics because I, you know, So eventually, I would say to some strong influences. I don't want to say, I was encouraged to study medicine, and then, fine, it was easy to do both, right? I combined. I mean, I did went through medical school, and I think to those who have that dilemma, right, because it could happen. I mean, medicine obviously is a noble science. It's the science of taking care of human health, right? It's I could say one of the most noble sciences ever. And you know, of course, getting involved and studying that helped me to understand the the intricacies of you know what it is like dealing with human health, right? And so I think that was very helpful. And then obviously as I got along studying in the course, you fall in love with it, you enjoy doing what you do. I think anything worth doing is worth doing well. And that's something that has always lived with me. So and from then on I was always passionate about patient experience, right? Um, Midway through clinical school where I began to like see patients, and leave all the basic anatomy and all that, you know, I was seeing a system that was very archaic, paper driven. Um, patients were called in the corridors to come in, files were so bulky, moving up and down. Um, this it was just too old fashioned. When it was time to do research, you had to go through archives, with handkerchiefs because they were so dusty, folders, and it just felt very I was like, this is not. In fact, I had friends in law who used to joke around that, because they too also had the same problem of being very paper driven and all that. And so I think that was when I first began to get obsessed about patient experience. So it's one thing to be a patient, then it's one thing to be patient with bad service, right? Um, and just anytime I had to, sit on the side of being a patient, I saw what people saw just to get to see a doctor. So I think that was where I got obsessed, first of all, with not just caring for the patient, but caring for the system. And I think that's what we currently lack in, you could say, in the broader society, right? Um, we need physicians who care about improving the system because a lot goes into actually delivering care that actually helps the patient to get well before the actual intervention, right? From the ambience of the hospital to the reception to the way you're treated to the courtesy to the less hassles moving from one department to the other. In fact, I dare say that a hospital, a full-fledged developed hospital, is one of the most complicated infrastructure. In fact, this was actually told to me by an architect who said that, for an architect, the only thing more complicated than designing a full-fledged purpose-built hospital was an airport. In an airport, you have people arriving, departure, luggage going left, right, those in transit between one point, their luggage has to move, immigration point, port health. At this point, you're stamped, your passport is checked, your visas are checked, your luggage is weighed, immigration checks this and that. So many things really happen. So many things really happen. Um, at the same time, right? That was how I got, kind of like involved with, healthcare and its development. And I think that has helped me because if I didn't understand the industry itself, the domain expertise, it would be very difficult to suggest solutions, right? And looking at the pain points that could exist. I think that was how I would say I fell in love with healthcare and not just healthcare, but healthcare systems improvement.
Beautiful. I like that bit because everyone who knows me knows that I'm all about domain expertise. And it's when you have that domain expertise, then you can able to suggest solutions in that area. And that's just how it is. And I'm keen to know because, I mean, looking at where you started from and where you are now, you've gone through quite some companies and had quite some experiences. So, how did you transition from being that medical doctor? I don't know. Did you ever work in the hospitals?
Yes, I did actually. I worked. for a few years. I think I worked a bit longer than you did. I think in so I think I worked for about 4 years
Oh,
as a clinician,
oh,
right?
okay.
Yeah, I worked for about 4 years. Um, in some cases, I was even actually put in charge of like very small clinics at a very, just almost fresh out of school, and having to coordinate things, put in place certain things, infection control trainings, and so many things. It was quite an intense immersion, as it were. um
So how
yeah,
did you
so that
go
was
from that?
mhm.
How did
to
you go
to
from
to
that to being a leader and an innovator in a health tech space? How did that happen? Can you take us through that process? Because that's where many people want to go to
want to
now. Exactly.
so for me, I think it was um so first of all, I had to be very strategic. I think it's important to plan, where, for those who are much younger, say where do you want to see yourself in the next 5 years, right? um Assuming you're a clinician, so for me it was very easy, right? I just had to say this was what I wanted to do, right, in the next 5 years. I didn't want to, I wasn't going to specialize as, in typical areas, and so I wanted to develop this pathway, as it were. So that's the first step, right? And then that now determines the kind of opportunities that come your way, and the kind of trainings that you need to put in place to get to where you want to go. So first of all, the first thing I knew was, okay, I needed to do an MBA, right? Because I felt like that was going to open up my mind, broaden my horizons, and all that. So I needed some years of experience to do the MBA. And how many years of experience did I need? 4 years. So that was how I put in my 4 years of experience. Um, so, and then after that, the opportunities that came my way, I was quite selective, right? At that point, and also in a way fortunate, because at that point, when I finished my MBA, there were the opportunities to obviously go into consulting, that's management consulting. There was the opportunity to go into other different aspects, finance. It was more like a general MBA. And at that point, there was something that, I was just, the healthcare space was kind of burgeoning. Everybody was talking about it. There was a lot of investments coming into the country, and an opportunity came up, and I went for it. At that point, it was a risk, right, which I took, because a lot of people were saying, "Oh, why don't you obviously take your medical career outside the country and all that?" And for me, I said to myself that, seeing the way the trends were happening and people were leaving, there were two things that could happen. I could either leave, right, and become one of them, or I could develop real solid experience. Um, I could develop real solid experience on the continent, right, between um, understanding how things work in Nigeria, in East Africa. And that was what I think I decided to choose, and say, okay, you know what, let me see how to explore all of this, right? And it was just a question of just being taking advantage of the opportunities that came up my way, and giving it the best of my abilities. And that was how I ended up where I am today.
Beautiful. So, in summary, opportunity meets preparedness. You were prepared, and
Absolutely.
opportunities came your way. That's my mantra, and I'm glad someone agrees with that because
Absolutely.
we say luck, but I think you also need to have something for luck to work. Yeah,
Absolutely.
grace, luck, and all that. You need to have something for that to play out. And as you've had quite an interesting career as well in a digital health space, in the medical space, but now we are focusing more on the digital health space, in the health tech space. What is the biggest struggle or challenge that you faced as you've navigated this journey, and how did you overcome them?
So I would say some of them were internal and some were external. So internally, there's always that, you know, hesitation, this hasn't been done, this is not a tested and trusted path. What does digital health mean? Yeah, are you a cardiologist? That kind of thing. So there was that self-doubt, right? That uncertainty that, you know, how will I make it big here? Will I, what does this space really look like? Is Africa really ready for this? Is this the right time to make this jump? So those are the internal things that one obviously has to deal with and keep in check. But then also from an external point of view, um, there were other challenges, right? Obviously, this was novel, this was new, this was not something that you had mentors or people to speak to about it, right? You were just simply looking at how tech had helped transform, for example, banking, e-commerce, right? These were things that I saw while in medical school, right? Um, how people were able to shop WhatsApp for business, people, internet economy, the gig economy, how people Uber came about, right? Can there be Uber for doctors? How would doctors perceive it? Would they join? Would they like it? Would they be able to amplify their time, their resources? So those are the things that, the uncertainty also of the market was also there. And, not having anybody, just sort of, it sounds like as if you're falling down in the sky and you're having to build a plane or a parachute for yourself before you land, right? So luckily, I was able to have some mentors, some people who I got to speak about things as I went along. People in traditional sectors, people who were open-minded, people who were encouraging. Some of them my peers, some of them much older people, some of them doctors who had, transitioned away from medicine, who were kind enough to like guide me, at different stages of my journey to say, okay, I think this is the right move. Some who said, okay, this is, help me to even further refine my journey to say, okay, you've done a bit of this, you've done a bit of that. I think digital health helps to bridge the two together because obviously technology is the future, you know, but everything technology, right? And then there's this other pillar. You need to also start developing some competence in this area. So I think that has been what has helped me. So the mentors also obviously helped me to unblock some of that haziness in terms of clarity in what I wanted to do. Um, and I'm very grateful to them till tomorrow because it wouldn't have been easy, especially you know when you have lot of people, your colleagues, everyone is just moving in it takes a lot of grit to actually go in a different direction from where the others are because you feel like you know this is everything okay and I think that has been what has helped me to navigate those challenges. Are there still challenges today? Yes, there are. But I feel like each day it becomes clearer and is even a lot better for me because I'm not as confused or as bothered about where I'm going in terms of my journey.
Beautiful. So we're going to put you in the foot of or the feet of your mentors right now. Now, what are you going to tell somebody who wants to make a meaningful impact like you have in the health tech space, but doesn't know where to start? What will you tell the person?
So, um, very, very, right now, I would say there's a lot of opportunity, right, within the health tech space. I think when I ventured into health tech, um, there, I mean, a lot of opportunities have actually opened up more now than ever before. At that time, I would say, first of all, pick a niche, right? Look for where exactly do you want to play in, right? So it could be in health operations, it could be in when I say health operations, I'm talking of like maybe improving, you know, doctor patient consultations, things like that. It could be AI. There are AI companies in healthcare that help to bridge that gap. I could mention some. I mean, there are like tons of companies, right? There's Intron, there are even multinational companies, even Google and Co are also moving into that space. But then there are also, as a doctor, right? There are also other areas that one can play in. So it could be in medical writing, right? Many of these digital tech companies obviously need medical writers, people who can understand copywriting, people who can, speak the language, who understand like, what healthcare is all about and how to make healthcare fun. There are other aspects, that have grown now a lot more than in the last 2 3 years, where you have medical influencers. That's also a niche area, right? If that's something that somebody enjoys doing, it's not just enough to just be on TikTok, on Instagram, but do you enjoy making content, for instance? Is that an area that you want to do to, medical advocacy, through digital media? Which is also tech, right? Is it in the aspect of programming? There are also doctors who understand how to code and build systems, right? That and that was something that I had at a point considered, right? Is it a question of learning code language? These days with ChatGPT, you don't even have to learn code. You can even write, you can ask AI to write code for you. So I would say, first of all, is to understand what the entire space is all about, right? First of all, understand what the space is about. Then look at your strengths, and then look at where you can actually play into. Are you good with investments? Um, are you good with, medical operations? Are you interested in medical, systems design? Are you good in advocacy? Um, and are you just, or you just want to try your hands on anything? And that's also very much welcome, right? There are traditional health startups that allow you to just get in, you know, and then build, co-design things with program managers and product owners in a health tech. So I think it's just, first of all, know your strengths, know what the space is about, have a plan, um, of how long you want to spend in each area or in areas you want to before you get to your destination, and touch base from time to time.
Beautiful. So I'm just going to summarize that as, first of all, understand the space, have a general knowledge, then look at your strengths, look at what's obtainable in the industry, have a plan, and then that could help you now pick a niche you follow through, and then from time to time you check base and touch base, like you said, and see what's going on and what works and what doesn't work. And that brings me to the next question. um for you in this, because we know that this field continuously changes, it's continuously revolving. Like 2 years ago with ChatGPT, it's like the whole world changed. And something else comes out last year, or there's now a whole new race between DeepSeek and ChatGPT, and new things are coming out every day. And we're finding new ways to solve new solutions, or old problems, new solutions to old problems. And so how do you stay motivated and continue to innovate in such an environment or such an industry that is just rapidly developing and rapidly changing? How do you manage?
So the beautiful thing about tech is that it doesn't allow you to become a dinosaur, right? If you're in the digital health space, you know, um, you have to be one step ahead, right? In the traditional health space, as a doctor, there's always that fear: would AI replace me? Would AI, why? Because you finished residency, you're now a specialist. If you're not careful, if you don't go for regular updates and see what the world is doing in that field, you could become obsolete. You could calcify, as I like to put it. You just become like, a stone age person. But in digital health, you're constantly at par with technology. Like, you just have to keep improving yourself. So for me, I enjoy it. It's a race to become better, and I enjoy it because you constantly see that it's not yet done, it's not yet finished. It could get better. It could get better, and I think that's the summary of medicine. Medicine is, sometimes you save a life, sometimes you just make the situation right. You may not have all the answers, but you're duty bound to make things better, to leave things better than you made them, even if you can't eliminate the danger or whatever. And I think, what keeps me is just that every day, constantly researching, finding out what to do, partnering. Um, you may not be able to design the best thing out there, but just looking for who you can partner with. And I say this because every day, on my desk, I see new ideas, like new things that blow my mind, you know. And it's fun. Like it makes you look forward to going to work because you see new ideas, new solutions that could further bring down the cost of healthcare in a continent where people don't even have access. And that if there's nothing much more exciting than that, I wonder what is, right? Um, Things that can open up opportunity for thousands of people, create new jobs, help improve patient monitoring, make things, improve the quality of life, improve the early detection of illnesses, like not just cancers, but diabetes, hypertension, those killer diseases. How do I improve, early detection of these things using the tools available to me? So how I stay motivated is first of all, that's something that you're excited about, right? You cannot be somebody that just has done something and then you are like, oh, please, can we take a break? No, it never stops, right? The journey to perfection is continuous, and I think that's what I look for. That's what I enjoy the most about my job, and that's what I like about digital health.
Beautiful. And in your in this period you spent practicing, what are some skills? Because people just want to at least not spend their time just trying this, that, the other one. What are the skills you think are most critical for success? If I want to get into this space, what are the skills you think
Mhm.
I should look at if I want to succeed? We like shortcuts. Real quickly in this space.
So I would say critical thinking. You need to have a critical thinking mindset. Um, you need to have a solutions oriented mindset as well. Luckily, most health professionals are already solutions oriented. You need to have a process mindset as well. Yes, your training as a physician or as a health professional tends to include some of these things, right? Um, Critical thinking already comes from just differential. If you, oh, could this person have this diagnosis? Could it be malaria? Could it be this? Could it be cough? Could it be respiratory illness? Could it be whatever? That alone already gives you some element of those critical thinking skills. But I think just further refining it, being able to think out of the box, it's important. An innovative mindset. Never say, um, don't don't ever think it cannot be done or it cannot be done well. It can always be done better. So have that flexible mindset to say, okay, yeah, that's also very key. Then be obsessed. I say this one last because it's very important. You have to be obsessed about patient experience because that's what it's all about, right? That's what digital health is all about. How do we improve the patient experience? Because it all comes down to the patient. We're talking in a world where the world is moving to patient-centered care. Everything is around the patient. That you take longer to document your case notes and keep the patient in the consulting room bores the patient. The patient just wants to come, spend some time seeing you, not have to wait for you to either enter the diagnosis and give them their medication so they're out of the hospital and where they want to be with their families, their loved ones. How do you improve that thing? That they want their medications delivered to them conveniently in their home. It's also very important. That's also digital health. That they want to be able to, have a voice call and then have everything sorted out. It's also that. So everything boils down to patient experience. You have to be, and I don't know where you can learn that. If you're not obsessed about improving patient experience, then one has no business. That's the first skill that is even required in digital health.
You know, the interesting thing is that sometimes when people ask this question, the first thing they start thinking of, or where people go to, is that they start thinking of what tech skills should I learn? Especially when they get into the digital health spaces, what tech should I go and learn Python? Should I go and learn coding? Should I go and learn this, that? And it's also interesting now. This World Economic Forum report on global jobs or something. I can't remember the title of the report that they publish every year. The top 10 skills, I think 70% of them were actually soft skills. These skills you mentioned. Yes, of course, being tech savvy, analytical skills, I've definitely needed, but that's like definitely, you know that you need those. But these soft skills, actually, you'd be saying if you're going to be in the healthcare space, you have to be patient oriented, patient centered. You have to be have that innovation mindset, critical thinking, solution oriented, process mindset. It needs to be there, and people forget that these soft skills actually what makes you different from someone who has just been obsessed with learning tools. Because if you just learn tools, a better tool is going to come tomorrow that will take over those skills, you know. But that's
Absolutely.
where we are all different from these AI models and AI tools because they can't learn patient centeredness. That is a human trait.
Absolutely.
That's a very human trait. And so they will never be able to take your job if you master the soft skills. And that's what many people forget. So people, you're hearing it from other people, not from me always ranting about it. That this is where we should try to focus our attention on, not really always thinking about what's the next tool to learn, what's the next coding, what's the other one. It's focus a lot on your soft skills, build your soft skills alongside the analytical tools and skills that you're learning. And just to wrap up, sort of, talking about your current role in Zero Health, we just want to know a bit about what you do and what legacy you hope to leave at your work at Zero Health, and how can other people contribute to such sort of transformative initiatives like what you do at Zero Health or what Zero Health does.
Great. So, Zuri Health is one of the fastest growing health tech companies in Africa. We started out 4 years ago, and now we started off with a very innovative way of reaching out to the underserved community. So think about it, telemedicine via SMS, right? Um, how do we get people who just have a mobile phone? And this is something that, in Kenya, you can send money via SMS, via small phones, a very tiny phone. You can just, what we have in Nigeria, like the USSD, but,
That's
a kind
M-Pesa,
of
right?
similar, yes. And the money moves, and it's in fact the first time I saw it, I was blown away. Like, I was like, what's going on? you know you pay people, everyone from the Uber guy to the guy selling bananas down the road. Everyone has that with a small phone, the smallest phone that they call a kabambi. You can speak with a doctor, right? And I think what that does is obviously that opens up new horizons. There are people who just want to find out, I have this rash, my baby is coughing, small ailments, right? That would have ordinarily congested the hospital's OPD, people waiting to be seen. They can have themselves, sorted out easily. And then we've grown to obviously a full-blown health tech where you have the mobile app, uh, um, and the opportunity to chat, with the doctor properly, have a video voice consultation and all that. I think now we're moving beyond that, right? Everyone is doing that right now. None of these things I've said is new on the continent. You have people who are doing SMS, you have people who are doing mobile apps and all that. And how many mobile apps are people going to have to handle their healthcare, right? Think about it. You just need one or two banking apps where your money is, and then you can buy airtime, pay your utility bills, buy data, transfer money, make payments for at the restaurant. You just need one app. You don't need so many things. But then in healthcare, you have people, you have multiple apps. One app to track your your step count, one app to track your if it's a lady hormonal cycle, one app for this, one app for that. So why don't you have one super app, right? And that's what we're trying to build now. We're trying to build a whole ecosystem whereby just being on the platform, right? If you're a doctor, you can earn. It's like you can also earn money, by seeing patients on the same app. If you're a patient, you can also have all your symptoms managed. You can track your blood pressure with your phone. That is through AI. So we are trying to live, basically to integrate artificial intelligence into our solution so that With the scan of your camera or your phone, you are able to detect certain, or even just your voice. We're able to detect the level of stress, your perfusion, the skin perfusion level, and your hemoglobin. We're able to, and all of this is in research, right? We're trying to obviously validate this, not just by just putting it, but actually going through a research process. So this is what we want to layer on AI to the common people, to people who live in rural communities who have the app to be able to access care, monitor themselves remotely, track their blood pressure without at a very, very subsidized cost. And I think that's where you could say we are going to, so that you have one app which people can monitor their health without having to have multiple various apps.
I like the idea of a super app because there's just a proliferation of apps everywhere. Like everybody's solution is app based,
Yeah.
and of course there's this term I saw somewhere called pilotitis, where we all pilot things and then we build apps for them, which is the easiest thing to do. And after a year or two, we abandon the project and then you have apps living there. And so you just have apps, 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 apps everywhere. So having one super app is quite innovative, and that's beautiful what you're doing at Zuri Health. And I'm going to put you on the spot. It's International Women's Day month. So what in all your career and all the things you've done, have you well, what do you think about women getting into the digital health space, or what do you think about the role women play? Not even getting, because of course women are doing amazing in the digital health space. We have to agree to that. But how can we better, or how can we make that space more comfortable or better for women to even play a bigger role?
Absolutely. So I would like to start by saying that first of all, many of the I owe part of where I am today to lots of women in that I met in my career, right? Some of the people who helped channel, my vision, my direction towards digital health have actually been women. Women who have excelled in even hospital management, I was privileged to work under, and women who also excelled in tech and who sort of showed me how to just be obsessed about the customer journey. I think at Zuri Health we're a women-led company, right? And we have two of the founders at Zuri Health are women, and within my team, there are lots of women also who have who hold leadership positions. One of the things I try to do is to give advantage to every woman, everyone, women or not, right? Especially women, to sort of um, because I feel like healthcare is also the typical healthcare in the home is built around women, right? Women are the ones who know when the child's vaccination is due. Women are the ones who know without any extra, just naturally, they do it very easily. So I think building around women, healthcare is by its nature, sort of thrives best when built around women. And I think in the digital health space, it can't be different, right? So just I think women should obviously already know that they already come with a, an added advantage, right, into the digital health space. They are naturally obsessed about the patients. They're naturally obsessed about the care journey. They are natural carers, and it's very easy for them to fit to thrive. Even now in code in writing codes and the actual tech skills, women are also taking the front stage. So I would say it's a lot more encouraging. I think women already have an added strength. um, I think it's something that they should pursue very actively. I personally give a lot of kudos to women, and also would want to encourage a lot more women to get into the space as well. And that way we can we can say we are really accelerating action and driving women involvement in digital health space.
Beautiful. So This is all from me. So I'm just going to read a couple of comments from the people who have turned in today. We have someone from Kenya who is just appreciating the work you're doing at Zuri Health. He said he has worked with your team before at Zuri Health and they like how you do your work. So kudos to you. So that's someone saying
That's
thank
what I'm
you.
saying. Thank you.
So, someone asked, could you recommend organizations? This is a common question we get. Could you recommend organizations one can volunteer to gain hands on skills in the digital health space? Do you know any organizations that offer this sort of thing or where one can search for one? I know it's country and context based as well. Yes.
Yeah. So I think the easiest way is to reach out on LinkedIn. I don't know, organizations, you could just, I think the best way is, it still works, right? I know people who have reached out to me on LinkedIn and I have actually, connected with some that I know at that point in time. It's good to reach out and see what you do. Say what you do. You never know. You may be able to. You may get lucky, especially if you are very clear, not just vague, saying, what I want to. What do you want? What value do you think you can offer? I think that helps. Um, connect with people in the space. I don't know of any organization. Mine or my organization is all I know right now, and yeah, you can reach out to me on LinkedIn if there are opportunities. I can obviously then open up to you. I'm actually very, very, we're constantly growing, so that's the beautiful thing about being a startup. We're constantly growing, constantly expanding to new countries. Right now we're in Kenya, Nigeria, Ghana, Cameroon, Zambia, and Senegal. So if you're in any of these countries, I mean, just reach out to me. We're definitely growing and expanding, and we're looking to hire teams, people within those countries. Even Tanzania and Uganda, we're planning to expand to, I think, sometime this year in Q2. So, I think it's easier for me to, if you reach out to me and tell me what exactly you can offer, and then we can take it from there.
Beautiful. So, a word of advice to anyone that's going to reach out to him, please clean up your LinkedIn. Make sure that before you go to meet people, first of all, make sure that you are worthy to be looked at. Make sure that I can look at your LinkedIn profile and say, okay, this is someone I can have a conversation with. You can request for a 10-minute coffee break. You can request for a 15-minute coffee chat to just say, hey, and don't just go writing a long episode. I need a job from you and all that. Who do I dare know you from? I'm not going to respond
Hmm.
to you. So, first of all,
Yeah.
get your LinkedIn in order, then reach out for like a 10-minute chat or explain yourself. I met you here, 10-minute chat. And also, like he said earlier on, go and understand the space first and then be clear. He said it right now, be clear about what you want to do. That makes it easier for them to know where to place you. So that way you don't go, oh, he said we should come and talk to him and then he ignored us. I will ignore you if you come and just, ramble about, I don't know where to put you and all that. It's difficult. So please do your homework before you go to meet people that come on our shows to say meet us for this or that. So please do your homework so that also when you come, it makes it easier for them to help you out if they can. So if there, I don't think we have any other questions. So thank you so much, Dr. Ozo. This has been an amazing conversation. I've also had a couple of insights myself. There's so many things that I've picked up from this conversation with you, and I like your very relaxed, chill nature. And it's been lovely, really chatting with you. And you being the first person on the show, this has been amazing. And I think it's a great start. You've blessed our show really well. And
Thank you.
I know it's going to go better and even better and better. So thank you so much. And thank you for understanding with the technical difficulties we had initially. It
No worries.
happens. Yeah.
Yeah.
Yeah. So thanks so much. Thank you, everybody. And have a very lovely evening, morning, afternoon, wherever you're going to be listening to this from. And happy new week, yo.
Thank
Bye.
you. Bye, everyone.
Bye.